Hi, I'm Dr. Rajdeep. I'm a dermatologist and dermatosurgeon practicing at Charma, a skin, hair and nail clinic attached to Chirag Hospital in JP Nagar 2nd Phase, Bangalore. Remember, a dermatologist is the only qualified person to treat problems of your skin, hair and nail. Do not fall prey to quacks. Acne is graded by dermatologists into 4 grades: grade 1, 2, 3 and 4. Grade 1 being the most common and it's just called as whiteheads or blackheads. Grade 2 is where you have small pus filled pimples or slight red pimples. Grade 3 is slightly bigger ones filled with pus or maybe red. And grade 4 is called as cystic acne, which are large big acne you might have seen in some people. So a cyst is a fluid filled cavity and acne cysts are usually seen in men. This is because acne is related to the hormone testosterone. So acne cysts are also more common in those who have family history of acne. So those who have both parents suffering from acne, they are more likely to get grade 4 acne. If you are a male, if you are a man, you are more likely to get grade 4 acne. So grade 4 acne, most of the time it requires oral medication. So it requires treatment for a long period of time. And once the acne is controlled, it might take 6 months to 1 year to control the acne. And once the acne is controlled, long-term maintenance is important. Otherwise, there is chance that this acne will recur. There is also other treatments for cystic acne. We do use Q-switch lasers and IPL to reduce the inflammation in this condition. We also use peels to reduce inflammation in this condition.